This video will be on the white blood cells called the leukocytes. So let's look at leukocytes compared to the red blood cell. While red blood cells were about 45% of your blood volume, leukocytes are actually less than 1% of your blood volume. So if you look again at our basic layout of the blood here, 55% plasma, 45% formed element, which is your blood cell. Red blood cells are the majority. The white blood cells and platelets are in this remaining less than 1%. You should have about 4,800 to about 11,000 white blood cells per cubic millimeter of blood. And notice that's a lot less than the red blood cells. Red blood cells were up to 4 to 5 million. So the ratio is about 1,000 to 1. And again, if you look back at that blood smear, notice again the majority are the red blood cells, one with no nuclei right here. And then you'll have a few scattered white blood cells with the nuclei inside of them. Now for infants, when they're just born, they might have actually up to about 18,000 white blood cells per millimeter cube. And that's because, think about when a baby is first born, they're exposed to a lot of new germs, if you will, that they've never been exposed to before, so they will actually increase their amount of white blood cells, because you might recall the white blood cells are there to defend against disease, or fight against disease. But then as the infant grows older, the white blood cell count will lower. Another interesting thing to note about the white blood cells is that they're the actual only complete cell of the 3 blood cell types. So remember, the complete cell has plasma membrane, cytoplasm, and nucleus. And you'll be able to see all of these in a white blood cell. So other characteristics of white blood cells or leukocytes, again, they protect against infection. And they do something called diapsidus. Diapsidus is the ability to leave the capillary blood vessel. And here's why this is important. Go back to the first characteristic, which is to fight infection. Think about where you might get an infection in your body. It could be anywhere, right? It could be in the blood, it could be on the skin, it could be another organ. So the idea is that the white blood cells need to be everywhere in your body. So they don't just stay in the blood vessel, they actually need to leave. And here you can actually see, here in red is the blood vessel, and the white blood cells inside of it, and here it's squeezing out, it's leaving the blood vessel. Right? And then here you see the splinter coming into the skin, and here you see the white blood cells coming out. Whereas red blood cells should more or less stay inside your blood vessels. If you see red blood cells outside of your vessels, then you're bleeding, and we know that's not good. Now when you have too many white blood cells, you have a disorder called leukocytosis. That's when you have above 11,000 white blood cells per cubic millimeter as an adult. And this is a problem because it says that your immune system, these white blood cells, are increasing because they're consistently trying to fight some disease. So it's an indicator that something's wrong with your health. Now, in lab, we will look at the 5 types of leukocytes. So I won't go into detail here in lecture. I will tell you about what each one does in lab, and we'll go look for them and discuss how that can be very informative as to if your person is healthy or not. So I've just put up the 5 types of white blood cells. They fall into 2 categories. So you have granulocytes, which include neutrophils, eosinophils, basophils, and then you have agranulocytes, which include lymphocytes and monocytes. And each one is going to do something slightly different. The percentages you see should be the percentages you should have in your body. So if you had 100 white blood cells, about 50 to 70 should be neutrophils and so on. That leads you to what we call the differential white blood cell count, which is counting to see how many of each type of white blood cell you have. And we'll be doing this in lab to use that as a tool to assess the health of a person. The last thing I want to talk about for white blood cells is a disorder called leukemia that you guys probably have heard of. Leukemia is actually a cancer of the white blood cell. So think about what you know about cancer. It's when the cells go through mitosis out of control. Right? So you might be thinking at first, well, why not have more white blood cells, right? More fighters against the disease. The problem is that the white blood cells that are produced are abnormal. So you end up having a bunch of white blood cells, but they're unhealthy. So here's a normal blood smear. Look at the red blood cell to white blood cell ratio. Notice you only see about 4 white blood cells. Here's a patient with leukemia. Notice there's a lot more white blood cells, and when we look further, we'll notice that these white blood cells are often not the right shape and they don't function well. There's 2 types of leukemia. You can have acute, which is quick onset, or chronic, which is slow and over a longer period of time. Some cures for leukemia include bone marrow transplant or a cord transplant. So the bone marrow transplant would help because bone marrow is where you can actually produce some new white blood cells, so that way you would get healthy white blood cells. Or cord transplant, right here, the umbilical cord has a lot of stem cells, and those stem cells could actually divide and become healthy white blood cells. So just a quick summary of leukocytes. The white blood cell count should be about 4,800 to 11,000 white blood cells per cubic millimeter of blood. Leukocytes defend against disease via diaphysis. There are 5 types of leukocytes. The differential white blood cell count can indicate a health condition. And leukemia is a cancer of white blood cells.